Hello, my name is Garvin. This video is about diverticulitis. So diverticulitis, what is it? So diverticula are small pouches sticking out of the side of the large intestine or the colon. If diverticula are present in your colon, the condition is known as diverticulosis. Diverticulosis is a very common condition, with 50% of people being affected by the condition and by the age of 50 years of age, and 70% by the age of 80. Diverticular disease can cause episodes of pain in your lower abdomen, as well as constipation and diarrhea. The condition can normally be treated by eating a high fibre diet. Diverticulitis is a condition that is associated with diverticular disease. It occurs when the pouches in the wall of your colon, or diverticula, become infected and inflamed. This can cause a constant severe pain and fever. 1 in 4 people with diverticular disease will experience at least one episode of diverticulitis. If left untreated, diverticulitis can be serious because the infection can spread to other parts of your body with potentially fatal results. However, diverticulitis can usually be successfully treated using antibiotics. If you have repeated episodes of the condition, surgical treatment may be recommended. The symptoms of diverticular disease include episodes of pain in your lower abdomen, usually in the lower left side. The pain may be brought on by eating or while bypassing stools, and breaking wind may help relieve pain. Feeling bloated, a change in bowel habits, such as diarrhea, can sometimes occur, but constipation is usually more common, and a small amount of blood in your stools. So the main symptoms of diverticulitis is a constant pain, which is normally severe and starts below your belly button before moving to the lower left-hand side of your abdomen. Besides severe stomach pain, other symptoms of diverticulitis include fever, a frequent need to urinate, and pain when you urinate, nausea, vomiting, constipation, and bleeding from your rectum. So diverticula usually develop when naturally weak places in your colon give way under pressure. This causes marble-sized pouches to protrude through the colon wall. Exactly how diverticula become inflamed or infected isn't clear. One theory is that the increased pressure in the colon can lead to the breakdown of the wall of the diverticula, leading to infection. These factors may increase your chance of getting diverticulitis. So, aging is the first one. You're more likely to get diverticulitis if you're over 40, although it's not known why. Too little fibre. Diverticulitis is rare in countries where people eat a high fibre diet that helps keep stool soft. Next is lack of exercise. So the lack of exercise has been associated with a greater risk of formation of diverticula, putting a person at risk of diverticulitis. Next is obesity. Being seriously overweight increases your odds of developing diverticulitis and diverticular bleeding. So how do you treat diverticulitis? Diverticular disease, in most cases of diverticular disease, can be treated at home. The over-the-counter OTC painkillers, paracetamol, is recommended to help relieve your symptoms. The type of painkiller known as non-steroidal anti-inflammatory drugs, such as aspirin and Nurofen, is not recommended because they may upset your stomach and increase the risk of internal bleeding. Eating a high fibre diet may initially help to control and then resolve your symptoms of diverticular disease. Some people will notice an improvement after a few days, but it may take a month for you to fully realise the benefits. If you're experiencing symptoms of constipation, you may be given a bulk-forming laxative like Fibrogel. These can cause flatulence and bloating. It is important to drink plenty of fluids, as this will prevent any obstruction in your digestive system. So for diverticulitis, if your diverticulitis is mild, the condition will often be able to be treated at home. Your GP will prescribe antibiotics for the infection, and you should take paracetamol for the pain. If you have diverticulitis, your GP may recommend that you stick to a fluid-only diet for a few days until your symptoms improve. You should then gradually introduce solid foods over 2 to 3 days. If your diverticulitis is more serious, you may require admission to hospital. Next would be surgery, and surgery may be considered if you have had 2 or more episodes of diverticulitis. So how do you live with diverticulitis? So number 1 would be to eat more fibre. High fibre foods such as fresh fruit and vegetables and whole grains soften waste material and help it pass more quickly through your colon. This reduces pressure inside your digestive tract. Drink plenty of fluids. So for fibre works by absorbing water and increasing the soft bulky waste in your colon. But if you don't drink enough liquid to replace what's absorbed, fibre can be constipating. And respond to bowel urges. When you need to use the bathroom, don't delay. Delaying bowel movements leads to harder stools that require more force to pass and increase pressure within your colon. Next would be exercise regularly. Exercise promotes normal bowel function and reduces pressure inside your colon. Try to exercise for at least 30 minutes on most days. So that brings this video to an end. For more information on diverticulitis, go to my website www.mytelehealth.info. Thank you for watching. Stay informed and stay healthy.